Sweet. So, Annika, why don't you just go ahead and introduce yourself, explain like what level you're at as a doctor, and then yeah, we can go from there.
Sure. So I'm UK trained. So I trained at Birmingham Uni and graduated 2012, and then worked for a couple of years in London, and then moved to Australia 2014, and have done lots of different things. And I'm now I think I'm like PGY 12 now. Um,
Yeah, it's a bit scary, hey, because I'm only like PGY 3, and to think like that, you can do all these different things in medicine, and yeah, it's like exciting stuff, hey.
yes, like it is a bit scary to think like, God, I've literally been qualified for 12 years. Like, what have I been doing? I mean, when I look back on it, I have actually done a lot, but yeah, it's a long time. But yeah, I've been in Melbourne for the last 10 years now. So
Yeah, that's super exciting. So if you go back to the origins of it, like I don't know if there was anything that like made you want to do medicine in the first place, or all those years ago when you graduated medical school and got into it for the first time. What sort of pushed you in that direction of becoming a doctor?
honestly, when I look back on it, like I don't really think I knew really what I was doing. Like no one in my family's medical, and I always liked science, like chemistry, biology were like my favorites. And I think my parents were kind of like they weren't ever really like pushy, but they were like, oh, you could do medicine, and then I was like, okay, I guess that's what I'll do. And then first time around, I didn't get into med school because I had no idea. I just like went into. I remember like going into the interviews and just hadn't really like thought I prepared, but I didn't really know, like, because I didn't really know anyone else doing it, and completely made a mess of it. And then like took a year out and worked in a pub and sort of did a bit more research and then got on. Um, and like really enjoyed med school. Like I really enjoyed like the degree and like the studying and stuff because I've always like quite enjoyed study. But yeah, like obviously clinical work is completely different to I don't think I really like knew what was involved.
Yeah, you never really know like what it's like until you actually start working and seeing patients and taking away from the textbooks, and you actually see like real life medicine. I don't know. I'm much more attracted to that than the textbook version lectures and tutorials and simulations. I want like the real thing. You know.
Yeah, I don't think like as an 18-year-old though, like, starting med school, like the actual reality of being a doctor, like I definitely didn't really know what I was going into. But saying that, don't I still think it was probably the right thing for me. It's just that when you start off at that age, and especially without having a medical background, like a lot of people have doctors as parents and sort of have a bit more of an idea of what is ahead of them. But for me, I just had no idea.
Yeah, I think I have a similar story to you. I'm sort of like the first like medical person in like my family or like relatives for like becoming a doctor, and it's sort of like a new path. You're not too sure what's going to happen, but you just sort of stick with your friends and get advice from people a couple of years ahead of you. Um, but what's like, how did it work in the UK? Like, was it like a 5 year medical degree or 4 years, or did you have to do an undergrad or something as well? Or
So it was 5 years. Like you didn't have to do an undergrad, so you could just go straight in, fresh from school. And I did like a what was it called? Like intercalated degree. So in the middle, so I did like a year, which was healthcare ethics and law, like in the middle, which was really good. I really enjoyed that. So I ended up doing like 6 years in the end. But yeah, that was like a complete break from med school and obviously like completely different. And I made some like really good friends that year as well because you kind of like there were people from different years and then you kind of rejoin the year below you. So I kind of left my original year and I've got like some good friends that I met during that year. So that was that was a good move for me.
and then you worked in the hospital setting for a number of years in the UK.
Yeah, so I was in Birmingham doing my like for med school and then I applied to London for my like foundation years. So you do like F1, F2 in the UK. And I got my like first choice, which was like West London. So I did my first year at Chelsea Westminster Hospital in London, which is not like a real NHS hospital. It's like a bit of a bubble. Like it's just like seems to have a lot more money than, I mean, it's in a very like affluent area. And it's just very like quite a nice hospital. So, and like a lot of celebs go there and things, it's got like a private wing. And then the second year I was at Ealing Hospital, which is the real NHS. So that was like, back to reality, like in the deep end. And I started off on like ortho. I was nights or something. It was like my first job. And I just remember being like, oh, like.
That is in the deep end, yeah.
Yeah, after being like in a very protected, like not very busy place to like suddenly, and there was no like senior staff around, like for ortho, they were on the phone, but they were like, you just don't phone them, like, unless it's really like dire. So yeah, that was, it wasn't the deep end, but you learn a lot, definitely.
And then, so how many years were you in at that time? It seems like you've done like your first two F1, F2, and then you've started working as like what we would call like a resident in Australia. Did you have any sort of like inkling as to like which direction you want to go in, or did you just sort of like want to do general stuff at that stage?
So I think I knew pretty early on, like, that I wasn't surgically minded, even though I'd ended up with quite a lot of surgical rotations. Because I think I'd kind of preferenced the location over the jobs at that point. Um, but I always knew, like I've never been really into surgery. I've always liked medicine, so like that was on my radar, and GP. I think I've always sort of thought I probably would end up doing GP. But definitely at that point, like F2 was coming to an end, and I'd met my Aussie boyfriend at that point, and was very open to like, I wasn't like, I want to do this. Like, I've never been like really set on like a career path. I was just like, let's see, go to Melbourne.
So then Aussie boyfriend came across and took you back to Australia.
Yes, whisked me away. Yeah. Um, no, like quite willingly. I mean, like looking back on it, like I did love London, and like if I hadn't met him at that time that I did, because he was on a 2-year like working visa, and it was finishing like at the same time that I finished my F2, so he had to go back, and we'd only been together like a year. Well, it was over a year, like a year and 4 or 5 months or something. So it's like fairly early days, but also long enough that it's like I don't really want to say bye forever, like at this point. So, and like I say, I was quite like open to a bit of an adventure. So, so my job finished, and I was like, I'll just go for a bit and see what happens.
And did you start working in the hospital straight away, or did you? Because, like, I mean, other countries have to do like AMC exams, or I don't know how you sort of found it, or you could describe like the process of coming across to Australia to like work as a doctor.
Yeah, it was actually really easy. Like very straightforward. I didn't have to do any exams or anything. I basically looked for jobs that were available, like my level, and there was a job advertised with Monash, for, it was a psych HMO. Like I'd never done psych, and I would have done any job, to be honest, like whatever was available. And yeah, so I just like did an interview. I think it was like at 4 a.m. or something. And it was really like a straightforward, like very basic. You know how some of the like the HMO interviews are just, how would you manage chest pain, that sort of thing. Like, and then they basically did all the visa stuff for me. So they did all the, just submitted all the paperwork or whatever, and then came out a few months later. So it was very easy.
That's really like reassuring to hear, because I know a lot of people from like England or Ireland or whatever come across, and or it's almost like a seamless transition into the Australian healthcare system. We have a lot of people coming into like the ED departments and things like that. So that's kind of like reassuring for you that if you wanted to move from the UK to Australia, it's just very easy to transfer.
Yeah, it was. Like I don't know if it's the same now. Obviously, it was like 10 years ago. Actually, I think it probably is. Like, I even heard now they're sort of giving grants and things to, like, get you over. And yeah, I mean, like, starting off doing psych at Dandenong, I mean, it was it was pretty straightforward. Like, it's very similar to the UK. It's just a lot nicer working here. I mean, I don't know. I haven't obviously worked in the UK now for 10 years, but I don't think it's any better. If anything, it's worse. Um, so yeah, I mean, there's the usual like frustrations with which is just medicine generally, like the rosters and trying to get holidays and things. I think that's hard in Australia or the UK, but like definitely in terms of support, like number of staff and pay, it's so much better.
Do you remember like what your one of your paychecks was, or like how much you'd be getting paid per hour back when you were working?
I really can't remember. I think I can't really remember. I got like a little bit more for being in London because they give you like a London waiting because it's expensive, obviously, being in London. Um, but I think it was like what I was getting in Australia was like almost double for like the same level and nicer shifts. And I think a lot of it as well was like just the support. So like definitely in the UK, like a med reg in the UK is like the most senior person in the hospital pretty much, like, and they run all the codes, they do everything, whereas like obviously when you start off as a med reg here, like the first year you're a med reg, you usually like you can be PGY3 or and you are very supported, the consultants are really available. The UK wasn't like that, like you're often just very much on your own, kind of sort of muddling your way through, and support is off-site and not always very happy to be contacted.
It's tricky how it works. I mean, obviously, it's not ideal if you want to go into a new environment and you feel so unsupported and everything. But it really makes you grow up super fast. I know all the UK like people who I've worked with are just like excellent clinicians, and they're like might be PGY3, but they're acting like a PGY5 or 6. So it's always like reassuring to have some of those guys on the team.
Yeah, I think definitely like confidence wise, like you learn a lot very quickly. So like I came across, I guess, feeling quite comfortable at the level that I was. But that fluctuates, like I don't know, confidence, like sometimes you feel really confident and other times you kind of doubt yourself, but that's maybe just me.
Yeah. No, we've worked together. You're excellent. What's the go from there? So you worked as a psych HMO over on the southeast in Monash, and then what did you do from then? Because obviously you've got a few kids as well that you had to look after along the way. I don't know if you took time off to do that or wanted to get into the GP training earlier, and yeah, what sort of happened there?
Oh, well, they came along a lot later. So I moved here 2014, so I did 6 months of psych, and then I looked into doing GP sort of early-ish, but because of the moratorium, so like if you're internationally trained, you have like a 10 years where from when you first register in Australia, where you have to work rural, like they won't give you a provider number like Metro. Um, and I think like I did think about doing GP, like just going and doing it then. And like in hindsight, if I could go back, I probably would have just like cracked on and done it before I had kids. But I think I was just like having fun and I was like doing lots of like I was like traveling a bit and I also was going home. I liked like the flexibility of like, going home every so often, once a year or twice a year for like longer periods of time. And so I was just like, oh no, I won't do it yet. And then I think I did like a couple of years of general. So I did like quite a few different things. I did out, and then I actually went to 2016. I thought, oh, I'll do ED because there was a St. V's ED reg job. And I was like, oh, I'll just apply for that, even though I like, wasn't sure that I wanted to do ED. And then I got that. And that was quite like a, that felt like quite a big step, because like St. V's, they were quite, it was like, oh, you're on the training program. And I was like, oh, I don't know if I really meant to be doing that. I didn't love it. And then I did 6 months of ED there, and then I went to Werribee as like part of a rotation in ED, and was more and more like, this is not what I want. And then my parents were going to come out at that Christmas, but they put me on nights, and I like really tried to change it and I couldn't. And then I was like, right, I'm just going to quit because life's too short. I want to spend Christmas with my family, and I don't even want to do ED, which, you know, probably wasn't really the right way to do it. But that's kind of, I was like, what will I regret more? Like looking back, like my parents coming out at Christmas and I'm working, doing a week of nights, or leaving. So I left, and they were fine about it, really. And then after that, I was like, right, I'm going to do BPT, because I'd always liked medicine. That was definitely more my thing. And GP, I'd sort of said, no, I don't want to go rural. So BPT I could do in the metro, and Monash I knew, and they knew me. So I got onto BPT. That was the next thing. Which I really enjoyed. Like I really liked that. But as I was going along during that, I was like, I think I still actually want to do GP. So I didn't do the exams, like finished before the exams, like sort of made that decision, but carried on BPT for a while, and then left, and locumed for a while. And I did like a few things. I was like, right, no, GP is what I will do in the future. So I did like an ONG rotation, like through Monash, just to kind of get a bit of GP type stuff. And then I sort of decided I just wanted to take a break and like locum a bit, and that's when the cosmetic thing sort of came along.
Yeah. So tell us about that. We'll go back to what you were talking about with like the 10-year thing for international grads, and then and we can talk about GP stuff a little bit later. But tell us about, so you found like some like cosmetic gig where you're doing that on the side.
Yeah, so I was looking into it for a while, like just something a bit different, like and fun, and I like, it's obviously really like a common thing to do now, like loads of doctors do it. But when I started doing it, it was kind of like starting to become more of a popular thing to do. Like the people in the industry that were doing it have generally been doing it for a long time. And it took me a while to work out like how to get in. Like it's hard to get into it, because people want you to have experience, and to actually get that experience is tricky. But the way I did it was I found this company that were actually coming across from Germany. They're like huge in Germany. They're like one of the biggest like aesthetics clinics in Europe. And they were launching in Australia, and they were kind of offering to train you up. And I actually ended up like going to Germany and doing like their training. Like it was like a really intense like few days in Germany. Like I tied it in with like a UK trip as well. And it was the most awful clinic. Like in it, like I don't regret it, because I got like a lot of experience very quick, and that's how I got in. And ultimately, like I've ended up like at a really lovely clinic, and kind of doing cosmetic medicine how I would want to do it now. But at the way that they did it was, they were very they were all about like bulk, like trying to get as many patients through the door as possible at cheap prices. So it was lots of like lip filler, like really young girls like wanting big lips, and like really not what I think that it should be. And I found that really hard to kind of. There was no flexibility in it. Like they pretty much told me what they wanted me to do, and um, obviously as like the prescribing doctor and the doctor like having the responsibility, like I pushed back for a long time, and in the end it just became like unmanageable. And actually like it was really like not a nice place to work. Like it was very like stressful in the end, because the type of patients that the place attracted were like you know, expecting, coming in sort of like, it was like they expected you to provide the service that they were paying for, rather than like paying for your like expertise and your opinion. They just wanted their lips done and that was it. And so so yeah, I was there for a while, like on and off. So I went and got married like the year that I was working there. So I went back to the UK, then I had like a long sort of break and honeymoon, and then I came back and was like, right, no more. And then I actually got like, I guess, kind of poached by the clinic that I'm at now, because it's like that's the thing with the industry. It's kind of like a word of mouth, like who knows who. And so I now, work at a clinic in Turak, and the guy who like owns those clinics, he's like been in the industry for years. Like he's really experienced them, and it's great. It's like completely different. It's very much like a lot more autonomy, and like you decide what you do, and the patients are completely different, like demographic, and yeah.
Yeah. No, that's a really interesting like way to do it. I mean, it's certainly not traditional at all, and you do a bit of this and a bit of that, and you're dabbling in all these different fields, and it may seem a little bit scattered at the outset, but it seems like you've come back and found the stuff that you're actually like really interested in, which is, I mean, GP stuff, and then all this cosmetic medicine on the side, which is, balancing your interests, which is cool.
Yeah, yeah. I think it definitely, like when I'm saying all that stuff to you, like I did ED and then I didn't want to carry on, and like I think looking back on it, it was really the reason I did that is because I always put my life first. Like if there was like something that I wanted to do at home, or like a trip, or like that was my priority. So I kind of work would fit in with what I wanted. And like I also think I got like a bit bored with things. Like if I didn't like ED, I sort of knew it wasn't for me. So like when there was an opportunity to leave, I sort of took it. And then it was like, right, what's next? But definitely now, like obviously I've had kids now, and I've had that kind of time out, and now I'm at the point where I can do GP. Like I think that's kind of settled down. Like I have a lot more focus now on what I'm doing, rather than yeah.
Yeah, for sure. And I mean, first of all, I mean, you've just told me that like you passed your GP exam, so you're now like officially like accepted into the GP program, correct?
Yeah, that's right. Yeah, so I start in Feb. So I've got to do ED again first, at the Austin. Although, yeah, I've obviously done so much stuff, and like I'm now applying for all of this to be recognised, so I can go straight into GP in Feb. And the amount of like stuff that I've done, like I've done, even aside from that ED time at St V's, I've done like rotations at Dandenong, and I've done so much. But it's a bit frustrating that just because it's not recent, like they want you to do it again. But that's okay. I feel like it's the last stepping stone, and it will be good. Like it will be good peds experience as well to do ED again, and then I can just start GP once and for all.
Yeah, I mean, it's a phenomenal achievement. I mean, you've got three kids, correct?
Yes.
Yeah. How did you sort of manage? like all the kids and work as a doctor, albeit you were doing different things, here and there, and traveling back home and taking time off and locuming and stuff. But how did you sort of find, having a family and doing this whole doctor thing?
Yeah. Well, the kids came along, so I've got twin boys. They're 4 in 2 weeks, and so they were born like peak COVID, so July 2020. Um, so I like finished at Monash. I took like a because I know Gen Med at Dandenong quite well now, so they were really good, and they like gave me a job like with the InReach team, like the for nursing homes and things, but doing sort of almost like the coordination and like advice to nursing homes. So it was like a desk job, so I wasn't like COVID facing, and I was obviously like heavily pregnant with twins, so that was ideal. So I did that, and then had the boys, and then I locumed again at Werribee afterwards. But um, I took like I think I went back to work. I went back to work actually at Flawless at the clinic, cosmetic clinic first, and just did like 1 day a week. And the boys were in childcare. And then I ended up doing like quite regular locuming at Werribee as a med reg, and that they were very good because they at that point they were like employing a lot of locums, and they kind of just booked me for whatever I wanted. Like I could kind of say like, I've got 3 days this week, and then they book it. Um, and that was quite good because I wasn't doing any antisocial hours. I just didn't do those shifts. I just picked the usually 8 till 5 or whatever. Um, and it was manageable. That was fine. But when my daughter came along, so she's 15 months, I feel like it's it's not just, you know, doubled in the work, it's like 5 times the work. Like just adding one extra kid. Um, and maybe the ages that the boys are as well now. It's definitely like a lot more of a juggle this year, it has been. I think because I'm doing this surgical rotation at the moment, and I'm only part-time, but it's one long day a week and then 2 half days, which again is really nice. They've given me these really nice hours. But the mornings I start at 7:30. So my husband has to get all three kids up, ready, and out the door to daycare. And then on the long day, he has to pick them up and get them all ready for bed. And it is like on your own, like it's quite a lot. Um, and yeah, so life is very busy, but we're making it work.
I think that's like you summed it up pretty well. You just make it work. I mean, it's certainly like a credit to you, because sometimes I'm like not even like getting myself properly ready, and I'm like, what if you had three other little ones, and you have to sort out where they're going to go for the day, what are they going to have for breakfast, how they're going to get picked up, and what time am I going to get home. I mean, yeah, that just gives me a headache almost thinking about that as a possibility.
Yeah, I think you just have to be really organized, and I think I am quite organized. Like I've got a spreadsheet for like meals, like because that is a big like part of it. Like what they're going to have for dinner. You have to always like have a plan, like get the food shop delivered. Um, have a cleaner. And I'm part time. There's lots of like mums that do that work full time and are trainees doing like really demanding training programs. Like my friend is she's a surgical fellow now, and she's got two little kids. She just had another baby, and she's like going straight back to work after 3 months, and that's what she wants. That's what she loves it, and she makes it work. And I guess like for me, like I couldn't do that. Like I think I part-time is enough. Like I like to be home with them for like I have one whole day off a week with all of them, and then I have 1 day just with Freya, my little girl. And I think without that I would feel like I barely see them. So but it's what suits you, isn't it?
Yeah, I think you summed it up earlier like really well, that you wanted to make your work, fit in around your life, which some people don't always want that, which is just like a different perspective, it's whatever that person, their individual needs and aspirations and everything. But it is very much possible to make your work fit in around your life, which I think you're just like a living, breathing example of how that sort of looks. To be honest.
Yeah, yeah, and I think like it might look like I really don't like work, but I do. Like I do really, I actually really love medicine, and like I've always like wanted to work and like go back to work, but not at the expense of like, especially now, like my family. So or my life, like definitely like my for me like my job is so I can have a good life, and but I still enjoy it when I'm there and I want to do a good job. Like that's why I'm like quite looking forward to GP now, because I know it's what I am going to do, and I can just now work at like doing the best that I can at it. I'm not having any more kids, like I know that, so there's no more like pregnancies in the pipeline or any more like maternity leave coming up, and the kids, it will start to get easier, you would think, as they get a bit older, and then once they're at school and things, I can kind of just really focus on where I want, like what I want to specialize in, and try and be, just try and do the best that I can.
Yeah, that's inspirational. What do you like? Is there any things that IMGs have to like tick off before they start applying for our like Australian training programs? I mean, from what I've read and like my knowledge, you just have to have your general registration and then fit in or like do the specific specialty requirements. Like for example, GP, they need to do like a written exam, and you need to have all this like recency of practice. But is there any like additional things from like an IMG point of view that you found?
Do you mean like for coming out here, like in the first place, to getting a job?
Like getting onto a GP training program or like a specialty training program that you found, is there any like additional requirements?
No, there wasn't really for me, but because I'm an Australian citizen, so I think that changes things. Like, I think if you, to be honest, I'm not completely sure, but like for me, I just applied as a citizen. So I kind of just went down, and once the moratorium was up, I could just apply to the general pathway. So I just kind of the same process as everyone else. But I know, like, definitely, like, say you're a GP in the UK and you wanted to come across and just practice straight away as a GP. Like, my friend did that. She lives in Perth. Um, and again, I think it's like fairly straightforward, but you do kind of, you have to kind of prove what you've done. But I don't think she really had many barriers to it. And I think there were plenty of like jobs available, like especially like because she does lots of like women's health and like, so she's always been quite in demand.
And what about, could you like expand on this like moratorium thing? Like if someone's listening, they have never heard of what it is and they're thinking about coming across. Yeah, do you want to just talk to us a little bit about that?
Yeah, so it's basically to do with getting a provider number. So obviously, like, there's areas of need outside of Metro Melbourne, and they kind of try and encourage doctors to go there. So when you first register with APRA, it's like a provisional registration. So from that date, that's when your like time towards your moratorium starts. So you don't even need to be working for all that time. Like, so my maternity leave or whatever is, it still counts. Like, as long as you're registered with APRA, and it's 10 years, from when you arrive to when it finishes. You can like speed up the moratorium. So if you go and like work rural for a while, that kind of like counts towards speeding up the time. But yeah, so for me, I couldn't apply to work Metro until now, and I still like I applied for an exemption. I think I actually like went down the path of thinking like I'll try and apply for GP and like see if I can get an exemption. That was when I just had the kids, I think. So I was like, I've got like baby twins, like I can't go and live in the middle of nowhere. But they say no, like they're very strict on on like the criteria. Like I think the criteria are like you have to, or it was based that basically kids don't count. But I think if you've got a partner who is also medical, that has to work in Metro, I think there's some way that you can do it. But basically, I didn't count because my husband's non-medical. And
So up until like the 10 years elapsed, which is what this year, you only had like a provisional provider number.
no. So I had it's the first year you arrive, it's provisional registration with APRA, and then you get general registration a year after. Um, but I had a provider number, but through the hospital system. So to get like a GP provider number, um, you have to do your moratorium time.
So you can't like go into like a specialty training program until that like 10 years has elapsed. You can work in the hospital system, right? Or
You can do a hospital training program. You can't do GP. So it's a GP provider number that is there to get like the Medicare benefits and things like you can't. Um,
because I always thought it was like if you like the 10-year rule was all about setting up like your private practice, and you can't do that until like the 10 years has elapsed. But is that what you're sort of talking about, or
no, that counts as well. So you can do like a public specialty training program, um, but then to get your own provider number, like independent of the hospital, you can't do that until your 10 years are done. Or like I say, you can accelerate your 10 years, but by going and working in the sticks for, a year, and that will count for something. Um, but yeah, for me, it was just waiting for it to finish, basically.
got you, got you. So yeah, that's interesting. So like just to clarify, because I feel like that's kind of confusing. You come across and you got to wait 10 years until you can get your own provider number, but then you can apply to different training programs, but you can't like set up shop and do your own thing with your own provider number because that doesn't kick into effect until 10 years has elapsed. But you can, I'm trying to think like you can just still like work at a hospital and be on a training program before that time.
Yeah, so that's what I was doing. I was doing like the ED training program, I was doing BPT. Because your provider number, I mean, I'm probably not using the right terms because there'll be terms that will kind of explain it better. And I think like this is right, but it's basically once you're like a fully qualified, it's a specialist provider number, essentially. You can't get a specialist provider number, whether that's, working in Gen Med or GP while you're subject to the moratorium. Um, but you can do the training in hospital, but you can't do GP training.
Is there like, did you know about that before you came across, or did you sort of like learn about it when you're already here and you're like, oh, this is kind of frustrating?
I think I did know a little bit. Definitely when I first applied to come out here, I didn't really know. And then I think once I had the job and I was like, oh, I could maybe do GP out there, depending on, at that point I was like, might just be out a year, It obviously ended up being much longer. But I think when I first started looking into it, I had some vague idea, but it was like really on the back burner. And then when I started to like seriously think about it, I was like, oh, that's a pain, because and that's why in hindsight, I should have, we say, maybe it was still the right thing because I was having a great time. Like, I don't think I was really in that space to like go and live on my own for 2 years, that probably wouldn't have been the right thing either. So anyway, I just put it off, and then doing it now.
Yeah, no, I think, yeah, as you said before, like you just make it work. And if it's, got to wait an extra couple years and it's COVID time, then whatever, like that's fine. You're just going to work around what, like the hand you get dealt.
I mean, there are some people that have applied during their moratorium, for like the rural pathway, and then have ended up getting places that are commutable, like just commutable. So like, an hour and a bit. but they're really not guaranteed. So like I looked into that quite a lot. And they're obviously like they're quite competitive places because they're like the metro ones, and they're few and far between. And I thought about sort of going and just seeing what I would get, but then I started having kids, and I was like, I'll just wait until I was towards the end of the moratorium anyway, and I thought I'll just wait and see, because adding that 2.5 hours commuting a day when you've got little children, that's a big thing as well. So
And sort of like if there was anyone like out there, wanting to have like a family when you're doing this whole doctor thing, and would there be anything or any advice you'd suggest to them? Or, obviously it's possible. There are, full-time surgeons who do it. There's every specialty under the world. People all have families and just make it work. It certainly can be tricky. I'm not doubting that for one moment, but yeah, what would you say to those people?
so it's completely doable. Like obviously it you have to have like a really good partner, I think. Like it has to be like team effort. And obviously like if your partner's medical as well, that kind of adds another level of trickiness, because you've got to balance like two rosters. I mean, my husband isn't, and his job is quite flexible in that he can leave work early to pick the kids up, and so that's handy. But we also don't have any other support here really. Like my family are all in the UK, and my husband is just got his dad here, and his dad helps where he can. But he has his limitations, especially with the kids. Are quite hard work. Like 4-year-old twins are pretty busy, so he can't always do everything. Can't help as much as he'd like. So I think that you do just make it work. Like I think like we're now about to go into my Austin rotation, where I'm starting off on nights, and I think like 3 weekends in a row or something. So Chris is my husband is going to have to take like the brunt of being a parenting for the first month or so. But then it kind of balances out, and it's like the end goal. I've got a goal now that I'm going to do GP, and it's not always going to be like this. And it's just kind of supporting each other, and just working out what your priorities are. Like for me, it's always been them, first, and work second, and how I can fit it in. And also I think as you get older and more experienced with the hospital system and working with people like consultants and admin people and things, I've definitely got more confident at asking for what I want and saying like like this surgical job, and just said, look, I need to get this rotation done. I need part-time. I really don't want to do nights if possible. And he was like, yeah, okay. And whereas I think like 5 years ago, I wouldn't have been confident to ask that. So I think you just kind of advocate for what you want a bit more, and then it's easier to make it work.
Yeah, I think that's a good point. Like a lot of people just might not know how to navigate that sort of space, but just asking for, say, a part-time job and saying, just being real with them and laying your cards on the table and saying, like, I've got a couple of kids, I actually cannot do, all this time, or I'd prefer to do these types of shifts. And, as long as they're aware, then they actually can accommodate. But if they're not aware, then you can't just expect them to, read your mind.
And all that they can say no, and then it's just like, well, it's not the right thing. Like I can't. I think like sometimes I used to overdo it a little bit. Like sometimes I would like overbook myself, like for locums and things, and then I'd be a bit like frazzled trying to make it all work. Whereas I think now I'm better at being like, no, I need that day, to do do stuff for the kids and get organized and things. So yeah, you just kind of learn as you go along, but it's ultimately like what suits you and your family, like how you make it work.
And For like the jobs that you've applied for, have they all been like part time with the kids, or have they been full time jobs you've accepted, but then asked them to like maybe modify, or just given them the heads up early? Like, how's that work?
So after having the boys, I just locumed, and like I say, it was really good setup because I just kind of said I can do, these are the dates I can do, and they just kind of booked me for those. And then I haven't, the first job I've done like on a proper, contract job is this Werribee one, and I just, yeah, like I say, I just asked for part time, and then the Austin job was advertised as full time or part time, and I just said, "Can I have part time?" And they said, "Would you like, zero point 0.5 or 0.75?" And I said, "I'll just have zero point 0.5 for now, but I might increase, like depending on. I probably won't." Um, so yeah, it's just kind of, there are jobs out there, and it's like a job sharing position. So it's, we're doing it with someone else, and then we just divide the shifts between us. Um,
Do you know that person, or do they just sort of like pair you up? I mean, obviously you can apply to those sorts of job sharing roles as a pair. Like if me and you wanted to go to the Alfred, we could go and apply to that together, and come in as a job sharing pair. But presumably, like you just applied to this by with like just by yourself, like one person.
Yeah, I just applied, and they've actually, it's a little bit strange because they've paired me with the other person. I had a chat with them on the phone the other day to divide the shifts, and he's like a fellow, an ED fellow, and he was like, "Oh, I've never been paired with an HMO before because usually we kind of split the shifts so that often he'll be like in charge of the department." It's like, well, please don't put me in charge of my first shift on nights. Um, but yeah, so that's a bit odd, but it should work. Like we've divided everything up, and it should be better because it's like 2 long shifts a week rather than the 3 kind of half shifts. So and it's also around the corner from my new house, so it's a lot closer.
Yeah, I mean that's the other thing. Trying to move house while you're doing while you're like being a doctor, while you're looking after 3 kids. I mean, yeah, hats off to you. It's phenomenal.
Yeah, I don't want to do it again anytime soon. It's really been because we moved twice in 6 weeks, so no more, no more for a while. It's been busy, but it'll be fine. Like we're here now, not going anywhere for a while, and like I say, I feel like it's the final few like hoops to jump through, and then we're in our new house, and then I can start a GP, metro, and yeah, like start working out like I want to do, whether I do skin or not sure.
Yeah, heaps of options. You're going to be like one of the most qualified GP trainees. Talking to some other people who, get on and they're like, PGY 3 or something like that, and you've got all this like different experience that you can draw on. I mean, yeah, like you're going to be a great GP, no doubts about it.
Yes, thank you. Like I definitely can't really imagine going into GP like fresh out of intern year. Like obviously lots of people do it, but just not just the clinical stuff, but just the like, you know, the way that you talk to patients and to get the information that you want, and how you deal with other specialties and things like that. It's all just comes with time and experience, and um, I think it will make some areas of GP like easier, but obviously it's still like going to be very different, huge learning curve. But um, yeah, and it will be, there's lots of things I've done, obviously like the cosmetic stuff that I can kind of combine with GP. Like I might do some skin cancer stuff, and yeah, so that'll be good.
Very cool. We might wrap it up, but I guess did you have any like words of wisdom that you wanted to share for someone like looking to do a similar-ish journey to you, who's thinking, I don't actually want to commit 110% of my time to work. I want to actually have a life outside of all this, and maybe have a family or whatever. any like words of advice?
I think I would just say like that there were lots of times along the way where I've been like, oh, I really should do this, I should do that, I should be on a training program, and that's why I sort of did ED, then I did BBT, and kind of maybe gave myself a bit of a hard time, being like, oh, everyone else is doing this and I'm not. Like, I think that if you're not sure what you want to do, like, it's really, really okay to just try different things. Like, you can always, I mean, not with everything. Obviously, if you want to do a super competitive specialty, like, you can't faff around for 10 years like I have, and then do ENT or something. But if you want to try different things to work out what you want to do, it's okay. Like, there's still plenty of opportunities at the end of it, and it's all right to prioritize your life, outside of work first, and make your work fit around you.
Yeah, no, I think that's excellent advice. I mean, you will just like you'll fall into where you almost should be in medicine, if that's like not too condescending or whatever, but like you'll sort of fit into where would suit best for you, whether that is doing a couple of days a week here and then maybe, locuming 2 days in the ED or whatever it is. Like, you work out a schedule and a specialty in a way that suits your personality and then fits in with everything that you want to do.
Yeah, and it's all useful, everything at the time you might be like, I'm just sort of bumming around, but actually it's all, everything that you do, you can get some value out of it, and something that it will be useful in the future. So yeah, I think you just have to go with, if something doesn't feel right, like ED, I was like, oh, should I just, push through? Like, even like started thinking I'll study for the exams. But it's like, no, like, you just have to go with what you think ultimately.
Yeah, you get a feeling with that sort of stuff. That's awesome. Thanks so much for having a little chat.
Yeah, cool.
All right, so that's the end of that conversation. If you want to be part of something like this, you think you have an interesting story in medicine to share, maybe it's how you got in, and maybe it's that you got on a different training program or you went through some adversity, if that's something that you think you'd be interested in doing, then send me a message. The link will be in the description, how you can get in touch. If you know someone else that's probably keen to share their story, or you think that they would be a great person to share on this, then definitely link them in and we can get them on. If you want to stick around, there's plenty of other videos on here to check out and keep you informed, keep you interested, and keep you learning more about medicine. So there you go. Otherwise, we'll see you next time. Bye.